So welcome to this staff engagement session about Lincolnshire Health and Care, which is a really radical programme for changing the way we deliver health and social care across our county of Lincolnshire. We know that it's been really quite difficult to deliver the sort of quality of care that most people would want to see over the last few years, and we need to look at how we deliver our care collectively so that we can do the best job we can as professionals, delivering good quality care and being caring people, supporting our patients, our clients, and indeed our friends and relatives as well. So what we have with Lincolnshire Health and Care is a set of proposals that start off with putting the neighbourhood team at the centre of everything that we do. We know from evidence from elsewhere that neighbourhood teams operating effectively with the resources that they need will actually reduce the chances of people ending up in hospital, and if they do end up in hospital, reduce the length of time that they need to stay there. And this is really important, as we all know, because we want people to be treated as near to home as possible, and we want to avoid some of the risks of particularly elderly people being in hospital. The model looks like this, that there are neighbourhood teams serving a population of 10,000 to 50,000 people. Now, partly that range is because we haven't come to a final conclusion yet, and partly because the size of the teams may well be different across our very diverse geographical area with all sorts of different populations. And those neighbourhood teams will consist of people from primary care, community mental health care, therapies, social work, the community and voluntary sector, and others as well, working together on a day-to-day basis to deliver really good proactive early intervention and prevention activities. Those neighbourhood teams will then be supported by our community hospitals. Now, we're very lucky to have the range of community hospitals that we've still got in Lincolnshire, and revitalising them to support those neighbourhood teams with the first port of call for urgent care, diagnostic services, and some specialist services, especially again for older people, will mean that neighbourhood teams have the support that they need to be able to deliver this really good quality of care. That will have a knock-on effect on our hospitals. So we expect that there will be fewer beds in hospitals, and exactly how those hospitals are configured is something that we're working out at the moment. Staff are really important in this process, which is why we've set up this series of staff engagement processes, and we want for you not just to hear what's going on, but actually also to contribute with some more of your ideas. And many staff have already been involved, but there are thousands of staff in the county involved in health and social care, and we want as many of you as possible to contribute to the work that's going on. The leaders of all of our health and social care organisations, whether they're providers or commissioners across the county, are really fully supportive of this. They've come together in a programme board which is giving every member of staff the permission to contribute the best they can to this process. You'll realise from what I've said that this whole new concept of health and social care in the county is going to mean a big change for many of us in the work that we do. The intention is to make that work even more worthwhile and even more fulfilling than it is at the moment. But it is likely to mean changes in a lot of people's jobs. I don't think it's going to change the number of people that we need to deliver health and social care, but it's about where they are and who they're working with. And we do recognise that in order to make this work, there's going to have to be a big investment in training, in organisational development, in working out how we behave as teams delivering services to the public out there. And you can be reassured that this is a really high priority for the programme board, that we get these programmes of change in place, as well as changing the structure of the services that we're delivering for people.